Hi, I'm Dr. Mark Poray, a sports and family chiropractor in Brooklyn, Ontario. Today I'm going to talk about sprained ankles. Now, it would be the rare person who has suffered a sprained ankle sometime in their life. They usually occur when what we think is under our feet is different from what is actually there. So our kinesthetic awareness disagrees with reality. You may be jumping, playing volleyball. When you drop down from your jump expecting flat ground, someone else's foot is under yours and you roll over on it. Or you may be jogging up the sidewalk and slip off it, rolling your ankle because your attention was somewhere else. What happens when you sprain an ankle? Well, in order to understand that, we have to take a look at the anatomy of the ankle. There are two large bones in your shin, the tibia and the fibula. These two bones have to join somehow with the 5 metatarsal bones of the foot. This occurs by way of a group of bones called the tarsal bones. These bones act like ball bearings, and they act between the two large bones, the two large long bones of the leg, and the 5 small long bones of the foot. The muscles of the leg pass right over the ankle as tendons attaching to various points in the foot. There are actually no muscles that attach to the tarsals. These bones attach to each other by ligaments only. So if you roll your ankle either inward or outward and the muscles of the leg are unable to react quickly enough, some of the tarsals may be pulled away from their position, stretching or tearing these small ligaments as they're pulled out. And they tend to stay out because there are no muscles to pull them back in, and the ligaments, as we know, have already been stretched. So the typical way of rehabbing a sprained ankle is to treat it with rest, ice, compression, and elevation. Generally, you'll add a variety of modalities like interferential current or ultrasound to speed things along. Now, at the appropriate time, most therapists gradually mobilize the joint and introduce graduated activity. If these procedures are not followed, then the soft tissues in the joint tend to become subject to recurrences due to unresolved instabilities. These instabilities occur because the ligaments stabilizing the ankle never do return to their proper length. The result is that the next time your ankle is placed in a hazardous position, about to roll over, the kinesthetic mechanisms are not mobilized until the ankle is further over, and then it's too late. This is why ankle sprains tend to recur repeatedly and become chronic if they're not properly rehabilitated. Very often there is one element overlooked in this rehab procedure. Let's use as an example the most common sprain, which is rolling the ankle backward and outward. The result is sprain of the anterior and lateral talofibular ligaments. Following typical rehab, the pain is gone and function returns. But what has been overlooked is that the talus bone, which was pulled up and out, has stayed out of position, creating a blockage, like a doorstop, to full dorsiflexion. Now, if you try to pull both ankles upward, you'll find that the affected one does not have the same range of motion, and may even be slightly painful when you try to bring that ankle up. This is where the sports chiropractor is essential. He or she can restore this small bone to its correct anatomic and functional position with a simple adjustment. Remember, no rehab is complete until this is taken care of. So no matter whether you see an athletic therapist, a physiotherapist, a kinesiologist, or a chiropractor for the rehabilitation of the sprained ankle, make sure that your sports chiropractor has cleared this one often overlooked aspect to get 100% function back. Not every therapist is trained to do this, so make sure you ask about that. I hope this has been helpful and answered your concerns about sprained ankles. I'm Dr. Mark Poray, and we're ready to help you with all your sports injuries at the Brooklyn Family Health Center in North Whitby, Ontario. You can learn more about other conditions at my website, www.drporay.com, or you can make an appointment by calling 905-655-5767. Thank you.